Hey everybody, it's John here. Hope all is well and you're off to a great start um, in this healthcare law and ethical considerations class. Um, so it is Tuesday, and I apologize for getting. I normally try to get a video up Monday or Tuesday each week, most weeks. And I'm still, I guess, trying to get used to this transition of ending one class and then starting another one, trying to get all the grades in for the prior class and starting another one. So that is the cause for my delay. So I apologize. I do see that we have several people who are already active in the discussion question for the week, which is great. So normally what I try to do is try to post a video just with some of my notes, some discussion from either the discussion question for the week or the reading material for the week or any other relevant information or newsworthy items related to the topic that we're dealing with for that week. So this week, I want to discuss some of my notes from just the introductory material and healthcare law and ethics in general, and also discuss some of my learnings from the previous class I just taught on this topic. And I think that hopefully will benefit you throughout the next 8 weeks we're together. So the concept of healthcare or the concept of ethics really permeates the entire healthcare industry. And in my prior class, there were almost everyone was already working in the healthcare industry. So I don't know if that's the case with this class or not. But so if you do work in the healthcare industry, you know that it's a highly regulated industry. There are many ethical situations that we deal with on a daily basis. I have never worked on the clinical side of healthcare, but I've worked with healthcare legal issues and ethical issues for over a decade. So I'm very familiar with some of the issues that are dealt with by a healthcare provider on a daily basis. But I mean, we'll go throughout the course and discuss various ethical issues and healthcare legal issues. But I mean, just from the broad perspective of healthcare, of the great debate of whether it's a right or a privilege, or if it's not. I mean, is it something that we all have a right to, or it isn't? A common theme in the last class were the ethical considerations of end of life issues. Seems like most people had some experience with that. And there are a lot of ethical considerations, and it is state laws have pretty much every state has a law or several laws to address end of life issues, advanced directives, DNRs, and things like that, and even insurance coverage. We're what is this 2019? So we're still almost 2 years away from the next presidential election, but we're already seeing many candidates that are discussing healthcare issues, and it is a very highly politicized issue, and particularly with respect to insurance coverage and denying people with pre-existing coverage, even narrow network plans. I don't know how familiar you are with narrow network plans, but it's a cost-saving technique by healthcare plans to narrow the specialty providers that someone can go to in order to cut down on costs. There are plans that, and the Affordable Care Act was designed to prevent some of this, but plans that carve out high-cost patients. To some extent, end-stage renal disease patients, for example, it's a very high-cost item. I think the Secretary of Health and Human Services, Azar, I think it was just yesterday, he talked about the high cost of dialysis patients, chronic dialysis patients, and how they could cut costs in that area, because it is very expensive. Cancer patients, very expensive. And a lot of these healthcare plans do what they can to carve out those high-cost patients from their risk pool in order to cut down on costs in general. And because it is a highly politicized issue, the discussion of ethics can quickly turn into a political debate, and that's obviously something I want to avoid in this class. I think we all have opinions on ethics, on politics, and which is great, and we should. And we should definitely be respectful of everyone else's thoughts on ethical issues and political issues. Not that we would ever get into politics in this class, but sometimes healthcare and politics unfortunately go hand in hand. And so, but it is possible to understand someone else's point of view that is not consistent with your own, and so we always want to be mindful of that throughout the course as we're responding to discussion questions. So, a couple of issues from the reading that I just took note about and wanted to discuss. If you look at Chapter 10 regarding patient confidentiality, there is a scenario that's outlined in there that says a physician from another office steps into your office and asks to see the chart of a neighbor whom he believes may have an infectious disease. He states that the neighbor is a good friend and that she will not mind if he reviews her medical chart. Is it legal for you to give the chart to this physician? So, it's a straight flat question. Is this permissible or not? And then the next question, should it be? What are the ethical considerations behind this? And I had a client at one point that it was a major university that no, it wasn't. Well, no, it wasn't. It was a hospital, and they in the hospital, I guess the local university, their starting quarterback hurt his leg. I don't remember exactly what the injury was, but it hurt something and went in for x-rays, and the x-rays turned out to be negative. And so one of the nurses or somebody, one of the healthcare providers there, went to Facebook and said, "Oh, good news! The quarterback here, x-rays were negative, and we'll most likely we'll play this Saturday." Well, that's not great, and so my client reached out to kind of discuss how to handle that from a HIPAA perspective. Anyways, my point with that is the ethical and the legal considerations on even privacy issues are things that we'll be discussing in this class, and want you to give some thought to. What about someone who presents to the emergency room and needs urgent care? What if the person doesn't have insurance, or that particular emergency department is out of network with the patient's plan? Is it legal or ethical to turn away the patient who is in need of emergency care? And to me, this question is a good example of how sometimes, and what you'll notice in this class, sometimes ethics and healthcare law are two totally different concepts. And so, as you go through we'll be studying this malpractice case throughout this course, and there are some ethical issues in there, but there are also some legal issues in there, and a lot of times those are totally separate. So you can do something completely ethical, as we define ethical behavior, and also incur legal liability for just not meeting the standard of care and being negligent in a particular service or procedure. So sometimes they're totally separate, but other times they overlap. And so, in this case, someone who goes to an emergency department is in need of some emergency care. Person doesn't have insurance. Is it legal or ethical to turn that person away? Well, that's actually addressed under federal law called EMTALA, Emergency Medical Treatment Labor Act. that says you can't ask someone what their insurance status is. If they show up to an emergency department, they're supposed to receive an assessment, a screening, and stabilizing care without first going through that screening process with respect to insurance or a method of payment. To me, definitely that's the right way to go ethically. But that our ethics are sometimes inform the legal framework that governs certain situations, and so EMTALA is a good example of that. There are other things like the Federal False Claims Act there's a at least in the legal world a pretty significant case several years back where one of the hospital's employee saw some numbers, do some data crunching, and noticed that they were being overpaid by, I don't remember, it was Medicaid or some government healthcare program, and this is, I mean, there are many cases like this, but in this particular one, the employee presented the data showing a multi-million-dollar overpayment to the senior executives of the hospital. It was totally ignored. Years go by, and ends up being a whistleblower case, which you'll read about in our reading throughout this course. But there's another thing. There's another issue where the ethically correct decision is if you've been paid too much, then to remediate that and refund that money that you're not entitled to. And there's a law that if you don't do what's ethically correct, you could incur significant penalties as a result. And so there's another example of where that may overlap: ethics and the legal components of a healthcare situation. Anyways, we're pretty heavy on ethics this first week, and I just wanted to help you make that distinction between ethics and healthcare law, because as you go through, and some of the milestone projects, as I think through it, asks you to identify ethical issues, ethical components to a certain case, and legal components to a certain case. And so I think it's important to create that distinction and understand that distinction exists. Two things I wanted to talk about with respect to just my learnings from the past class, and maybe something that can help you. The first is, how do you conduct a legal analysis? You'll be asked a few times in various assignments throughout this class to conduct a legal analysis as we study this malpractice case. I think it's out of Hawaii. You'll read about what's referred to as the IRAC method of analysis, and that's a really good framework for legal analysis. IRAC, I stands for issue, R rule, A application, C conclusion. So you identify the issue, identify the rule, apply the rule to the facts, and then come up with your legal conclusion. The important piece to me in a legal analysis is identify each element of a rule. So, for example, we're going to be discussing medical malpractice quite a bit throughout the next 8 weeks. And there are 4 elements to a malpractice case, and I think the text refers to them as the 4 Ds, duty. I don't remember them, but regardless of the terminology, the first element is duty, duty to provide a certain level of care, and normally that duty is created when there's a physician-patient relationship. The second is a breach of that duty, so a breach of the standard of care that is normally required for whatever the service or procedure that is being provided. The third is causation, so the breach of that duty actually has to cause the harm. And the fourth element is damages or harm. There has to be some sort of harm in order for there to be a case. And so a good analysis will take, a poor analysis will say, this case, there's clearly negligence because of A, B, and C, and D. Well, that's not really an analysis, because negligence is really nothing unless you talk about the four elements of negligence. So the important thing about a legal analysis is if you knock out one of those four elements, then you do not have negligence at all. You don't have medical malpractice at all. And so it's important to say, okay, well, there's a duty here because there's a physician-patient relationship. There's the physician. Here's the rule, the standard that you have to meet the standard, whatever the rule is. You have to meet the standard of care. Blah blah blah. Here are the facts. The facts are that the doctor used improper device or did this wrong and did this wrong. And apply those facts to the rule and come up with your conclusion, and do that for each element. And then in the end, after you've analyzed each element, your conclusion is, okay, well, this is a good case for medical malpractice, or it's not, depending on your analysis. So anyways, there'll be several times throughout the course that you'll be asked to do some sort of analysis. And I think it's just really important to recognize that analysis requires weaving and applying facts to rules throughout the analysis. So if you have any questions, let me know. I make myself available. You can contact me by email. I'm pretty quick about responding normally. If you want to set up a time to chat, happy to do that. Just my schedule is sometimes a little crazy, so let's plan some time to do that. Or text. All my information has been posted in the announcements page on the website. The one final thing that I think will help as we go through the different assignments in the class is it makes it, in terms of assignments and papers, it makes it really easy to read and to grade if you follow the rubric in the sequence the rubric lays out. So if there are 5 rows of the rubric of what the requirements are for that particular assignment, it's super helpful if you have 5 different sections in your paper. Section 1, whatever the first row of the rubric says, identify the stakeholders in the case, and then identify those. Section 2, and so on and so on. It just really helps me identify if you've followed the requirements of the rubric and you have everything in there that you need, and it makes the process go by much smoother. So, which I'm all for. Anyways, that's all I have. Again, super excited to go through this class with you. I'm very passionate about healthcare law and excited to share some information with you and to facilitate some discussions throughout the next eight weeks. So hope you have a great week. Again, if you need anything, please let me know, and we will just move forward. Thanks. Bye.